Hi, it's Dr. Bradbury with Wellberry Health here again. We're talking about another one of the 6 pillars of lifestyle medicine, or the 6 pillars of your health. Today's pillar is avoiding risky substances. So I want to touch on a few points here. One is there are obvious things that most of us know to avoid, like IV drug use. But then there's things that slip in that we don't think about as much, and people can dive down the rabbit hole of risky substances as far as they want, even into wondering where their food came from or how it was prepared and seeing if there is any contamination there. Now, fortunately, here in the US, for the most part, we don't have to worry about those things. For the most part, our food is generally safe. Of course, if you want to get into more specifics about certain substances that may be in our food, GMOs, plastics, whatever it is, I understand. I'm talking broad, sweeping strokes here. In general, most of us can eat a meal and have it not kill us. So, what I'd like to address more then is the bigger substances, the kind of low-hanging fruit in society, that if we went after these things, we would see broad, huge, sweeping strokes of improvement in the general public's health. So first off, I mentioned IV drug abuse. We know not to do it. People do it. It's actually way more common than you think. A lot of people are very high functioning, living in normal society. If you're one of those people, come talk to us. There's no legal action or any reporting or anything. I just want to give you the help that we can to help you get back to your best self without that. Then there's the abuse of prescription drugs, either medications that were prescribed to you or prescribed to a loved one or prescribed to a complete stranger, or maybe they were just got off the street. This would be your fentanyls, oxycodone, um, and even muscle relaxers, things like that. Okay. So any medication you take that's not in the way it was prescribed is very dangerous. Even medications that we take the way that are prescribed aren't exactly safe. That's why you have the guidance of a doctor while you're taking this medication. So if you're taking medication that is not prescribed for you, or you're taking it in a way that was not prescribed for you, please see a doctor, get some help. There are great resources for you. We can even do some de-prescribing, help you out. Or maybe you're on a medication that's like a controlled substance. That means it's when you go to the pharmacy, they give you kind of a hassle if you come in too early for it because it has potential to be sold on the street and abused. If you're on one of those kind of medications, again, come see a doctor, get some help. Odds are you may not need to be on that medication, or you certainly, or at least not on that dose that you're taking. Those are things we love to address here at our clinic. So please give us a talk, give us a phone call, give us a message, anything. Just reach out for help. Now let's take a step down to less hard drugs, right? The most common socially accepted ones are alcohol and smoking. Now, alcohol is the most socially accepted one, and we find it causes a lot of issues for people. A lot of people are finding trouble sleeping, they're finding increased anxiety, worsening depression. Ironically, people use alcohol to help them sleep or to help deal with anxiety or to help drown out depression or whatever it is. But in the long run, alcohol is another substance, almost like a medication that just makes things worse. And it's another substance you're relying on, right? And who wants to rely on a substance for the rest of their life? I don't know anyone that says, "Oh, I just love to rely on something for the rest of my life." So we'd like to take steps to get away from that. And then smoking. Smoking is, while not as socially accepted as alcohol, it's still pretty accepted by a lot of people. And when I say smoking, let's broaden that term to tobacco, both smokeless tobacco and smoking tobacco. And then you could even throw vaping in there, the nicotine products as well. So these have huge effects on your lungs and on your skin, on your teeth, on your mouth, putting an increased risk for skin cancer in the mouth, cancer in the lungs, and increased risk of heart disease, high blood pressure, eventual stroke, all things we can avoid just by eliminating a substance, okay? And then marijuana. Marijuana is a debated topic. There's not a lot of great evidence out there for it being a positive for anyone or even any CBD products. I know people use it for anxiety and depression, PTSD, things like that. But overall, we see a net negative effect from marijuana in the medical field. as in have seen way more issues with people using it than people not using it. And patients are pretty honest about when they're using stuff with me. So I'd encourage people, avoid these things. If you want help stopping, or if you're looking for an alternative way to deal with other health problems you're dealing with, please come give us a chat. Come talk with us. Other things, caffeine. Caffeine is the most socially accepted risky substance. Caffeine, you're just living in fight or flight all day long, and it's not helping you in the long run. It's masking the symptoms of a behavior that needs modified. So that's usually sleep or anxiety or nutrition, something along those lines. So let's talk about ways we can get away from those. Okay. So this is just a quick message today. I don't have too many details. All these things we talked about using risky substances have issues, but you can set goals. And I know there's addiction with many of these, if not all of them. So actually, I said it's going to be short, but let's talk about addiction for a minute. Addiction has been labeled as, people think, oh, the substance, my body, my genes. There's something about it that I just can't change. Funny enough, research is showing that the more socially connected you are to positive behaviors and positive people, the less likely you are to hold on to an addiction. You find that it's just not it's not compatible with your new life and your new group. So I love these pillars of lifestyle medicine, or the pillars of your health, because if you work on one of them, it helps the others too. So I like to encourage people to double down on social connection if they're struggling with addiction, and people find a lot of success that way. So if you have questions, comments, I'd love to hear from them. Leave a message, or send us a direct message, or give us a phone call, or send us an email. We just love to hear from you. I hope I get to see you in the clinic someday. Thanks.